I'd like to now move to Ms. Annette Kennedy, President of the International Council of Nurses, a federation of more than 130 national associations representing more than 20 million nurses worldwide. Annette was also commissioner on the WHO Independent High-Level Commission on Non-Communicable Diseases and Director of Professional Development for the Irish Nurses and Midwives Organization for 19 years. She is a registered nurse and a midwife. Ms. Kennedy, this year is the International Year of the Nurse and Midwife. So it is fitting that nurses have been in the spotlight like never before. Nurses comprise the majority of the health workforce worldwide, and many nurses working through the pandemic have been exposed daily to the virus as they work lengthy hours in high-risk situations without adequate personal protective gear. From your work with nurses associations around the world, what needs to be done to better support and recognize nurses in their work, and what measures must be undertaken to build the capacity of nursing and health work professions?
Thank you, Annette. Thank you, Madam Chair. Your Excellencies, it's a great pleasure for me to speak on this United Nations Public Services Day. As you said, I represent nurses, and since the very beginning of the COVID-19, we have been hearing from our associations all around the world. We, at the beginning of the year, we had planned to celebrate the Year of the Nurse and the Midwife. We had planned in every locality and every country and every area throughout the world to celebrate and showcase nursing. But of course, COVID-19 changed all that. And with it came what we now see, that nurses are essential to the service, essential to the health service, to the backbone of the health service. They've always been the backbone of the health service, but it has never been recognised until now. And of course, we started hearing about the issues that are facing the frontline health workers, and particularly nurses, as they make up 60% of the health workforce. And they are with the patients probably 12 hours, 14 hours a day. So they're most at risk. And the issues that were facing them was the lack of protective equipment. And we started calling on governments, even from that early stages in end of January, for protective equipment to protect our healthcare workers and particularly our nurses. But even as late as last Friday, we've been hearing from our colleagues in Latin America and in Africa that they still haven't sufficient protective equipment. And in fact, they haven't got masks and they haven't got gloves. And the protective equipment they have aren't suitable, they're inadequate, they're too small. So it's like giving people, protective equipment that doesn't fit. You might as well have nothing. It's not going to protect you. The second issue that we're really concerned about is the fact that they don't have access to testing. Frontline staff, particularly nurses, should have access to regular testing, because what we are hearing is that a lot of nurses are becoming infected with COVID-19 and are actually dying, and some have committed suicide. So we have been asking for governments for surveillance to trace and to investigate infections of all healthcare workers, but to identify by grade and by profession, and to have standardized collections and reporting to WHO so that we can identify where this is happening, how it's happening, why it's happening, and that we can further prevent infection. This is the least that can be done to protect our healthcare workers and particularly our nurses. There is a duty of care to these people. And the third thing that is really upsetting us is the violence that's been perpetrated against nurses. Abuse, chlorine being thrown at them, spitting, and recently in Mexico, extortion, where we had nurses being kidnapped and their relatives being forced to pay money in order to get them back safely. This is unacceptable, and governments must call and see that these perpetrators are brought to justice. We cannot have this for people who are putting their lives at risk. And we also see that nurses have been doing a lot in relation to organising and making sure that the services are right for, not just for COVID-19, but for other people who need the service, need health service. but they're not involved in policy. They're not involved in strategic planning. And this is unacceptable because they know more about patients than anybody else. But to go back to what can be done, and the State of the World's Nursing Report brought out by WHO in April indicated a number of areas that can improve things. So there's a roadmap to improve the service, and it means investing in the service. Because we have seen from COVID-19, the first thing that happened was that nurses were being called back into the service, retired nurses, nurses that hadn't finished their program from the university, nurses that were doing part-time work were being called back. So it's obvious that we were short nurses. We know that we're short 6 million nurses, but we're even short right now. So we need to invest and we need to protect them. So we need to build nursing capacity. We need to allow nurses to work to their full potential because they're doing nurse-led services, they're doing advanced practice, and we need the legislation and we need the regulation to allow them to practice. We need them to be involved in leadership and policy because they know more about the people that they look after from birth to death and from community to a hospital and from families. And we also need, if we want to retain the nurses in the service, we need to make sure they have better conditions of employment and better pay. Otherwise, we are not going to retain them in the service and we won't have a service, that's for sure. But just to, I suppose, represent the nurses themselves. I had a letter from a nurse on the front line, and I'm going to read an excerpt from her letter, which more portrays what nurses are going through now and going through on a regular basis than I could ever say. So with your permission, I'll read it. Our lives now, engaged in hospital in COVID-19, are like a continuous roller coaster ride. Fatigue and anger, then sedated by the first successes on patients that you can finally transfer from the intensive care unit, and with who, despite the short time and those dressed that barely allow us to breathe, find time to talk and communicate with them, to make them feel they are not alone. We're the only company they have, and it is impossible to smile with a mask, but we learn to talk and smile with our eyes. The system is not protecting us, and we have to fight for COVID testing and for proper PPE. Nurses even look for donations or for families to help them. If all the nurses stopped now, there would be the greatest human disaster of recent times. The reality is that everyone knows this fact, and we as nurses know it too. And it is perhaps one of the only real reasons why we continue to struggle with dedication and professionalism in this emergency, even at the cost of our own lives. At this emergency, we have already arrived exhausted, with a salary blocked for about 20 years, with staffing levels reduced to the bone, in a social landscape strongly changed to chronicity. But nurses have always remained, despite the increase in duties and continued disappearance of our rights, ensuring that citizens maintain their health. And the signs on our faces are the only evident part of the scars we have inside, for being worried, for being not enough, or being too tired to give the best assistance to our patients, or to come back home and infect our families. Our attitude is to think and take care of people, and we are doing this to the best of our ability.